I'm Alireza Fakhri-Ravari, and along with my colleague Tori Kobata, would like to welcome you to this poster presentation entitled Oral Step-Down versus Continued Intravenous Treatment of Gram-Negative Bacteremia, a Retrospective Cohort Study. First, let's take a look at the background leading to this research. Gram-negative bacteremia is a leading cause of hospitalizations in North America with about 300,000 cases annually. Patients typically receive IV therapy initially, but national guidelines do not define the optimal route of administration. There is limited evidence to suggest that step-down to oral therapy has similar efficacy as continued IV treatment. Benefits of oral therapy include reduced length of hospital stay, decreased risk for IV-related catheter infections, and lower healthcare costs. However, studies of oral treatment are largely observational and use mostly fluoroquinolones due to their high oral bioavailability. The purpose of this study was to evaluate the efficacy of the two treatment strategies at Loma Linda University Medical Center. Next, let's take a look at the methods. This retrospective cohort study included patients 18 years and older hospitalized with monomicrobial gram-negative bloodstream infections at Loma Linda University Medical Center from February 1st, 2013 through August 30th, 2014, and data collection is ongoing. Patients converted to antibiotic oral step-down therapy were compared to those who continued IV therapy for the entire treatment course. The primary composite outcome was 30-day return to emergency department with the same gram-negative bacteremia, clinical worsening, or 30-day all-cause mortality. Now let's take a look at the results. In a cohort of 120 patients with monomicrobial gram-negative bacteremia, 71 patients met study eligibility, 29 patients in oral step-down therapy group, and 42 patients in continued IV therapy group. The mean age in eligible patients was 56 years, and about 55% of patients were male. The source of bacteremia was mainly due to urine infection in 55%, and 11% was catheter-related infections, and GI infections constituted 11% of infections. Baseline characteristics were generally similar between the groups, but patients in continued IV therapy group had significantly higher PET bacteremia score and a higher rate of fluoroquinolone resistance. You can see the baseline characteristics in this table. There was no significant difference between the groups for the primary outcome, with an odds ratio of 0.27 and a 95% confidence interval going from 0.01 to 2.60 and a p-value of 0.39. Multivariate logistic regression did not identify any independent predictors for the primary endpoint. However, the length of hospital stay was significantly lower in the oral step-down therapy group, with a difference of negative 6.2 days. You can see the results of the logistic regression in this table, with none of the variables reaching statistical significance. Of course, this study has many limitations. Some of them include small sample size, low incidence of primary outcome. It did not assess if adequate source control had been achieved. We were unable to account for food or drug interactions with oral antibiotics that may affect enteral absorption, and we were unable to assess adherence with prescribed antimicrobial agents after discharge from hospital. In conclusion, oral step-down therapy seems to be as effective as continued IV therapy, with no apparent difference in treatment failure among hospitalized patients with gram-negative bacteremia. Patients with bacteraemia caused by fluoroquinolone-resistant organisms are less likely to transition to oral therapy, which increases the length of hospital stay. We will continue to collect data to increase the power of this study. Thank you for attending this presentation.